Welcome to WizeUp. I'm Paul Arthur, looking forward to talking about healthcare today. We all know something needs to get fixed for sure. And what about the possibility of introducing some measure of private healthcare? Now that, I think to a lot of people, gets a little bit scary, but reality is we have long wait times. We have shortages of doctors, hospital beds, hospitals. These kinds of issues are, it's not small potatoes. We need to deal with this, right? So today's guest is Nadeem Esmail. He's a senior fellow at the Fraser Institute, a think tank here in Canada. He's been doing healthcare research there for something like 20 years. He's well informed on this topic, so you can check out some of his articles, some of his writings at FraserInstitute.org. Good to have you with us, Nadeem.
Thanks for having me on the show.
Oh, you bet. Looking forward to the conversation here. Tell us, where are we at right now in Canada, Nadeem? I mean, I guess wait times for surgery, wait times for doctors, these kinds of things. Are we improving? Are we about the same? Are we declining?
This is the healthcare system in a steady state of decline. We rank internationally quite poorly. In fact, we have some of the worst access to physicians and medical technologies in the developed world, alongside some of the longest waiting lists for access to healthcare in the developed world. And those waiting lists keep getting longer and longer each year. We've reached a new record now, yet again, in 2023. The 24 numbers will be out in another month or so, where we're finding Canadians on average waiting over 6 months from general practitioner referral to treatment by a medical specialist. So remarkably long waits, very poor access to physicians, to medical technologies, to hospital beds, in spite of the fact that Canada maintains one of the developed world's most expensive universal access healthcare systems. It's really not a great story for how we stack up today.
That is not good news. 6 months, that's a long wait if you've got some serious health problems. Now, again, you mentioned how we compare to some of the other countries. And when I'm talking countries that we compare ourselves to, these are wealthy nations that are similar to Canada, right? Typically democracies and so forth. But you're saying we are not in the top three for sure, right?
Correct. Well, we are in the top three for spending. This is a comparison of universal access healthcare systems in developed nations around the world. So this would be against the United Kingdom, Scandinavian countries, Western Europe, Australia, Japan. We outstrip nearly everybody on the expenditure side and yet lag them almost all when it comes to access to services and availability of services.
That's not good. Which countries have the best healthcare results? And let me ask, why do they have the best healthcare results? Are these, again, universal healthcare models like similar to what we're doing here, or are there some differences?
There are meaningful differences in the way those other high developed nations deliver healthcare and the way we do here in Canada. Canada is unique in having no private parallel option for patients who are wanting to seek an alternative to the government or universal system. We are in the minority when it comes to user fees or cost sharing. Most developed nations have user fees for access to services. We are in the minority when it comes to how care is provided. We have a largely public monopolistic hospital sector where in other developed nations there's more private competition and more entrepreneurial initiative in the delivery of healthcare services. And for hospital services, those services are typically funded on the basis of the number of patients and types of patients treated, not on a budgetary basis like we do here in Canada. So some meaningful differences in how those healthcare systems are structured relative to how ours is structured. And as a result, they get far better value for money.
And again, which are the top three nations, I guess? Do we have the rankings, like which ones are top three as far as results go?
It's hard to judge because there are so many different factors when it comes to assessing the goodness of a universal access healthcare system. But if we want to talk about the best outcomes from the healthcare process, we're going to look to countries like Switzerland, Japan, Australia, France. If we want to look at some of the best access to healthcare in the developed world, some of the shortest wait times are almost a non-existent wait time structure, we're going to look to Austria, Belgium, Germany, Japan, Switzerland again. The Netherlands is now up there for access. So there are a couple of different ways of cutting it. You'll notice some of those nations do repeat on both lists, but certainly there are any number of different ways to do universal access healthcare out there that are far superior factually and in a data-driven sense to the Canadian model.
And again, these countries seem to be using some types of private healthcare mixed along with the universal healthcare. Now, in Canada, we do have some private health care? And that, I think, varies from province to province. So what do we have available right now in Canada as far as private health care?
When it comes to private alternatives or an alternative to the public system, that would be very much a Quebec thing. Thanks to the Joly decision in the mid 2000s, Quebec has opened up the private parallel option for certain services. It's quite restrictive, but it is there. And that has certainly, when we look across the provinces, Quebec has always been a bit unique in having slightly shorter wait times than the other provinces without having a very high level of expenditure relative to other provinces. When we want to talk on the provision side, we'd be talking about Alberta, Ontario, British Columbia, where there's some private contracting for services. But again, it's all very marginal in Canada relative to what happens in Europe, where in Europe, if the public system is unwilling or unable to meet your needs, you can simply seek out the care privately if you choose to do so. Even in Sweden, in Stockholm, the capital of Sweden, you can go to a private for-profit hospital, a full-service hospital, run by Capio, a private company under the terms of the universal access healthcare system, or seek your care privately if you choose to do so. So we really don't have the sort of private competition and delivery in Canada that we find in European healthcare systems or in the Australian system or Japanese system, but there is, you're right, a little bit at the fringes in some provinces.
Okay. So we don't have a lot compared to what we're seeing in Europe. What can we do to improve our healthcare system when we observe these other countries? What can we learn from them? What could we emulate here?
I think there's a great deal we can learn from abroad. And as we look at the structure of universal access healthcare systems, we know from the economic research and from theory that user fees or cost sharing, a small fee for accessing a physician's office or going to the emergency room to remind patients that there is a positive cost to these services, that can have a meaningful impact on the demand for healthcare. When we look internationally, we find all of the top performing nations, whether it's outcomes from the process or access to care, have user fees or cost sharing. In fact, the majority.
You just. Sorry, I was just going to jump in there for a second. User fees, man. I'm just looking, and I can feel it right now. There are rotten tomatoes being thrown at the screen at you right now, Nadeem, for even daring to think that way. How dare you? I've got to fork something out. Of course, there's a lot of stuff being forked out already through our tax dollars. It's not free. Somebody's got to pay for it. We just don't see it coming out of our wallet, right? So what does this do? When we have a user fee, whether that's $10, $20, $50, I'm not sure what kind of amounts we're talking about in some of these other nations here. How did the public respond to this when it was introduced, whether that's Germany or the Netherlands or wherever?
The user fees in most of these systems have been there since their inception. It's very common to find them in Scandinavian countries where, for example, in Sweden, it would be $20 to see the general practitioner, $25 to see the medical specialist. Australia has different rates and different programs. When you go into Switzerland or into Germany, you have deductibles, so there's a minimum amount to be spent out of pocket before insurance kicks in. And then once insurance kicks in, there's still a co-payment to be completed until another higher level is met. In every one of these nations, there are strong protections for those in need, for low-income populations, those with chronic health conditions, and for people having a major medical event. That has to be in place. But the idea is to encourage a more informed decision about when and where it's best to access the healthcare system. I'm not feeling well today. Is it really worth me going to the emergency room and paying $20 or $25? Should I wait for my doctor's office on Monday where I'll spend $10? Maybe I'll go see the pharmacist for free. The idea is to make sure that people are trading off lifestyle choices versus healthcare. So we're choosing between our Starbucks tomorrow and going to see the doctor, and to ensure that protections are in place so that people are never trading off their rent or their food versus healthcare, which is an inappropriate trade-off to be asking people to make. Mm-hmm. What we see in the economic research is when that user fee is in place, the demand for healthcare can fall as much as 20 or 30%, simply as people are making different decisions about their healthcare. And we don't see any negative health consequences from that as long as those strong protections are in place for low-income populations, for vulnerable populations, and for the chronically ill.
Okay.
And it works very well.
Yeah, yes, you just addressed a lot of the issues that people would, raise a red flag to, and you're saying, well, no, there's ways to make this work as long as you've got these, guidelines in place to protect those who are vulnerable, and it's working in some of these other countries. So why do we refuse to look at it? I've got some of my own kids. don't have a family doctor. So they have to go to the ER, to see, okay, I've got a cold, it's not going away. Is this strep? Is it whatever? So they got to wait in there forever. And the ER maybe looks at them saying, what are you doing here? It's not an emergency. Well, I've got nowhere else to go. So, shortages of physicians is certainly an issue here too. So how are these other nations, I guess, getting enough physicians and medical staff for their population?
First, they had just have more of them. They simply have more physicians than we do. In the 1990s, Canadian physician medical training was reduced out of concern for a future surplus of doctors and the cost consequences of that surplus. It turns out by the mid-2000s, that policy had worked perfectly. We had reduced the physician supply, or at least maintained it perfectly since the mid-1990s. Unfortunately, that's just not enough doctors for Canadian demand. In part, a user fee reduces the demand for healthcare services, which means our physicians are reallocated to different priorities. We might want to say higher priorities, but we know that it's different priorities. But we also need more physicians here. We simply need to have more physicians trained in our medical schools. We need to have, I think, clearer streams for internationals. And there is some ridiculousness out there that needs to be dealt with. I'm not sure if every one of your viewers has seen it, but there was a piece in the Globe and Mail recently about a doctor in the United States, a US-trained doctor, fully certified, who couldn't move to Ontario and get a position there because the immigration system was being roughly obstructionist in terms of the requirements being placed on her. A roster of 1,500 patients waiting for her, and she couldn't get her immigration to Canada to be a doctor. So we need to deal with some of these things, I think, to be a little more efficient with our services.
Yeah, there's something seriously wrong with that. I just read an article here the other day as well on Ontario Premier Doug Ford, and apparently their system there, they're not going to be allowing foreign students into the Ontario, to be studying to become a physician. Did I read that correctly? I'm going, why, if you've got a shortage, and I know there's an immigration issue, but, in this case, obviously we need these kinds of immigrants to fill that great need we have for more physicians.
I think part of the issue, and it comes back to a lot of the common issues with the Canadian healthcare system, it's political football, and it's become a political game. It's driven by political decisions. It's driven by a government decision over how many folks will be trained each year, how we'll handle that training. And we end up with these really unusual outcomes. We have unemployed medical specialists in Canada, fully trained surgeons, certified, ready to go, can't find a hospital placement, so they can't actually ply their trade. We have surgeons who would do more work and more hours, happily do more surgeries, but they can't get the surgical time. If we look internationally at the nations that have more physicians per thousand population or greater physician to population ratio, we see less government involvement in the number of physicians that will be trained. It's more of an open marketplace, the way we have here in Canada for dentists or engineers or scientists, where people choose to go into this trade, and if they can find their opportunity and do well, then that is their opportunity. But there's less command and control, very much unlike what we see in Canadian healthcare, where governments have their thumb on the system, and that doesn't always work out in the patient's favor, or certainly in taxpayers' favor.
I'm told the red tape can be an issue as well for physicians, spending a lot of time on this sort of thing. So if we could somehow, I guess, have the government reduce the requirement for all these different forms or whatever it is that's slowing down the doctors, when they could be seeing patients instead of doing this tedial, red tape stuff, right? Got to fill out all the forms. Is there something to be done there that other nations are doing better?
I think there is a certain quantity of red tape in the system, and some administration is always required. And as healthcare systems advance, as we have more medical records and electronic medical records and communication, inevitably we'll see some increase, I think. One of the issues, though, in Canadian healthcare is the administrative load. We know in Ontario, the entire hospital increase was consumed by administrative payrolls. We've seen any number of studies and reviews finding that the Canadian healthcare system has a very high number of administrators relative to other developed nations' healthcare systems, or certainly even relative to the private sector. So there are some things I think that need to be cleaned up. And one of the easiest ways to deal with this, of course, is private competition, to allow private providers in to compete for the delivery of universally accessible services, the way we see in Switzerland, Germany, Australia, Sweden. Universal access healthcare systems doing a better job than our own, in large part because they allow that private entrepreneurial initiative in. And certainly there's survey evidence out there that says Canadians are open to this. Canadians are increasingly open to allowing entrepreneurs to come in and see if they can't fix the healthcare system recognizing that governments have proven so far entirely incapable of solving our healthcare woes. Certainly, the Quebec government is doing some interesting things that I think will have some very positive impacts. I think here in Alberta, we're seeing the Premier try to make some smart reforms, try to build the structure in place, but it's really not moving, I think, as quickly as patients may wish, and we still have such a huge problem to deal with on a day-to-day basis.
Well, let's talk about a little about what Alberta is trying to do here. Premier Smith apparently planning to lease new hospitals to Alberta Health Services with the option of transferring these operations to another operator if the government decides that AHS isn't doing a good enough job with this. Right now, a lot of people see that as I think as radical and risky. Your thoughts?
I think this is the beginning of the right policy structure that we need to see in Alberta. When we look internationally at those other healthcare systems, we ask the question, how are their hospital sectors structured? They're contestable. That is, they have money following patients to the facility of the patient's choosing, which means the facilities need to work to attract patients rather than simply get paid a budget to exist the way we do here in Alberta today. And we have opportunity for other providers to come into that sector and take over those facilities or take over that hospital service to attract more patients to their facility instead. That requires a contractual structure at the beginning. In order to do that, you must first begin by having a contractual structure for the delivery of services and the right funding models. So I think we're seeing the Alberta government put the basic building blocks in place to begin down that road. Quebec has already been down this road. We're seeing Quebec now saying by another 2 years from now, all hospital services will be delivered on an activity funded or per patient basis, and that contractual structure has already been built in. It moves very slowly in Canada. I think that's one of the unfortunate things about healthcare reform in this country is we tend to move quite slowly. But I think the building blocks are being put in place there. It remains to be seen if the Alberta government is actually able to get to where we hope they will, where we're taking those lessons from other countries and understanding how to get a better performing universal access hospital sector. But certainly, I think there's nothing scary here. These are the building blocks that we need in place, that contractual arm's length relationship with between the payers of healthcare, the government, and the providers of healthcare, Alberta Health Services, or another institution, so that we can get some real proper monitoring and supervision of how that hospital sector is functioning and create that opportunity to have that competition in that sector for patient care.
Yeah, I think competition is a good thing. I think there's so much fear we've had here in Canada for many, many years over. I think the idea, as soon as you mention private healthcare, we automatically think, I don't want to have anything like they have in America, right? And of course, you didn't say that. I didn't say that, but we think that. Again, maybe that's just from an overdose of mainstream media. I'm not sure. But there has to be some way, I guess, of communicating this to, the average public person out there, average citizen, that this isn't meaning to be a carbon copy of the U.S. system at all, or probably much more of the European system. And again, that's, I guess, going to take some time. And I wonder, too, is it possibly a fear of, for example, if we have a private system, I guess it's our humanness. We don't want anybody getting ahead of ourselves, right? So, it makes sense if somebody with more money gets health care quicker than we do. It perhaps makes me jealous, right? But wouldn't that shorten the lineup for me to begin with? Is this part of the equation here?
Absolutely. That private parallel sector allows people to exit the universal queue. That does create more room then for the remainder of the patients who are there. And let's be clear, the wealthy in Canada are already leaving the Canadian healthcare system. They're going to other provinces and purchasing care privately, which is possible, or they're going to the United States. Increasingly, these folks traveling for healthcare are less wealthy. They're going to the Caribbean, to Southeast Asia for their healthcare. We need to create those opportunities here at home. There's no reason we can't serve that market here at home and create an economic opportunity for entrepreneurs here in Canada, or even attract patients from other countries into the system. This is a great way to make better use of physician resources, which are lying idle, we know, unable to provide as much surgery as they might wish to in the public system in a lot of cases. An opportunity to bring in some of those underemployed or unemployed specialists who are ready to serve in the Canadian system. This is a great way of enhancing Canadian healthcare. And we know when we look at European countries like Sweden, like Switzerland, like Germany, when we look to Australia, which is demographically and geographically quite similar to Canada in terms of population distribution, this is a way to get better universal access healthcare. The goal has to be a better universal access healthcare system, and in a private parallel option is one of the paths to getting there.
Hmm. Do you ever get nasty emails from some of our Canadian healthcare unions? I'm just curious. Because
Certainly,
I'm seeing this so often that this opposition to you can't introduce any kind of private stuff or man you get pushback from the unions, don't you?
well, absolutely, it's in their interest to protect the system that is in place now because it is to their benefit. I'm going to go back a few decades now, actually, in the early 2000s. We did a review looking at the wages paid in hospitals in Vancouver versus wages paid in five-star downtown resorts. And what we found is there was about a 20% difference between the resort and the hospital for cleaners, which makes sense, I think, intuitively. Hospitals can be fairly disgusting places, and there's a lot going on in a hospital that you hopefully won't find in a hotel room. But the really big differences in pay were for payroll clerks. It was almost 40% for payroll clerks. The baker at Vancouver General Hospital was being paid 40% more than the pastry chef at the downtown five-star resort. Now
Wow.
that tells me either something's quite wrong with our allocation of resources or I was taking my wife to the wrong restaurant for our anniversary dinner.
Okay. Here's another objection that comes up fairly regularly. So if we go to a private healthcare system, will that cause, I guess, the best physicians to simply stay within the private healthcare, and the rest of us are stuck with a guy who got, barely a passing grade, and he's doing heart surgery on me, right?
I think it's a common fear and it's an understandable fear, but let's look at what actually happens in practice. When we look at Australia, and in fact, in most of the Western world, we find the private sector is focusing on more of the assembly line straightforward cases because that's where the private sector excels. It excels at standardized processes that can generate a lot of efficiency or within which efficiencies can be generated rather. When you look to the really complex, sophisticated, high-tech medicine, the complex patients, the patients whose outcomes are harder to predict, whose process will be harder to predict, they tend to be in the public hospitals. They're already in the public hospitals today in Canada, mixed in with these other cases. And so in Australia, the really prestigious, complex medical care is done in the public system, and the physicians want to be a part of it. And we also know that the private sector probably can't provide enough opportunity for a physician to entirely leave the public system. And so, what we want to see in Canada, I think, is dual practice where physicians can work in both sectors, private and public, so they can practice on the really complicated cases where you have all of the crazy technology involved, where you have all of the sophisticated work being done, as well as do assembly line medicine on the side, where you're processing through all of the joint replacements at high speed, getting great outcomes for patients and removing them from the public queue. It is a
Okay.
genuine fear, I think, among people, but it is unfounded when we look at what actually works in other developed nations and how it works.
Another issue that we should probably touch base on is the diagnostic testing, MRIs, CT scans, these kinds of things, right? Again, a fairly long lineup for these, as I understand. So how do we, speed that up? And I'm assuming this again would naturally speed up if we had some competition and had some privatization of this, right?
Absolutely. There is some opportunity. Certainly, we know the MRIs are slightly underutilized. We also know we have very few of them. Part of this is, again, having investments in capital infrastructure. And this is yet another area where the private sector excels relative to the government sector. Governments tend not to invest in medical technologies and physical structures because they don't vote. They want to put their money where voters are actually going to move, whereas the private sector focuses very much on how to deliver more and better healthcare for the dollar to attract more patients, which generally means a greater access to medical technologies. And we see that again when we change hospital funding, which Alberta is working towards and Quebec is doing. We tend to see a higher availability of medical technologies and medical resources because that's how patients get processed through better and faster.
Sometimes I hear people say provinces should invest in preventative medicine. Again, maybe making, I guess herbs and things like that more available. I don't know, naturalistic options and funding some of that. Do any of the European nations do that?
Complementary and alternative medicines, the coverage varies from nation to nation, but it's
Mm-hmm.
fairly commonly not within the universal structure.
Okay.
We have to also remember always that preventative medicine is good medicine. We want more primary care. We want good preventative medicine. It's not necessarily cost saving. This is not a golden bullet to solving our healthcare problems.
Right. Okay. Well, when you take a look at the big picture, I know it's different from province to province, but when you look at the Canadian healthcare landscape, where do you see our healthcare system going over the next decade? Are there going to be any significant changes you think that are going to make a difference?
I think increasingly there's opportunity for real positive change. Certainly, we're seeing in polls Canadians becoming more and more open to an alternative. In part, I think in response to how terrible the healthcare system has become. It's now a morning talk show conversation about how poor access to healthcare is in this country. I think we're seeing governments being pulled kicking and screaming in that direction, recognizing that there is some real opportunity and the Canadians want better. And we know we're spending an awful lot of money on healthcare. We know we pay very high taxes in part to fund the healthcare system, and Canadians are seeking value for money. So I think there's some opportunity, there's some movement, but I'm cautious because I said that before. I said that in sort of the 2013-14 period where we saw a lot of Canadians being very interested in healthcare reform. We saw some opportunity opening up, and then nothing happened. Governments went right back to the old formula of more money, more promises, nothing better actually being delivered other than a bigger bill. So I'm cautiously optimistic, and I hope for the best.
Got to be cautious. Thank you so much for sharing all your knowledge with us here today. Appreciate it.
Thanks so much for having me on the show.
All right, Nadeem Esmail, you can check out a lot of his research online at FraserInstitute.org. I encourage you to do that. And I encourage you to speak out too. Talk to your doctors, to your neighbors, to your nurses, and let them know that, you're open to more private health care because we think it's going to make a difference. Okay. Thanks for watching today. You can watch or listen to podcasts on WizeUp.ca or return to Reason.com. And of course, you can always fire us an email with any show suggestions. Paul at WizeUp.ca. God bless.